Tonight we speak with Dr. Forde, Infectious Diseases Specialist and the head of isolation facilities here in Barbados, a gentleman who has been going non-stop for almost a year now. Good evening to you, Dr. Forde.
Good evening, and here I am again. It's a real pleasure to be here to talk to you and to talk to all Barbadians out there as to what's going on across the country in terms of our cases with regards to COVID-19. This certainly has been a very trying time in country for us, and it continues to be a difficult time right now. And one of the things I want to spend a bit of time on talking today is to really encourage Barbadians to change their behaviors as they are. But I guess we'll talk about that a bit more later, and to give you an idea of what's going on within our facilities.
Yes, and tell us what is going on right now in terms of the actual numbers in isolation facilities.
Okay, great. So I will choose to approach this way. As you know, across the country, to let people understand what's actually happening in our isolation facilities, so there's no curiosity. And as you well know, I'm a very straightforward guy.
We know.
So I'll tell you. So at Harson's Point, we know, everybody on the call knows there's a primary isolation, a secondary isolation, which is really our intensive care setting where we have our illest patients. And then the tertiary isolation, which people have mild disease or asymptomatic and who are new. So we kind of repurpose things a bit, which is to say, look, people who are in the tertiary isolation who have to be monitored for a particular period of time, depending on many different factors. So I can't give you a particular day. But when we think that they're past a point where they could be in trouble in terms of the ability to get ill, although that's variable, to get ill, then we will let those persons go on to some of the other areas. Before it was Blackmon Gollop, now it's a Savannah Hotel or and Sambay Hotel, which is these are other sites for isolation. So people are not admitted directly to those facilities. They're monitored first at Harson's Point, and then they're transferred often around day 5, day 6 of admission to the facility. If they have comorbidities, we might choose to monitor them there because we know a lot of those individuals get in trouble. But of course, we now know, certainly in Barbados, I think the wave is changing, which I'll talk about later, is that we're getting a more younger population of individuals who are presenting ill or who are becoming ill. I think one of the concepts which I need to get out of the scope of the public is this idea of symptomatology. And people always run away and say, well, I have no symptoms, I'm asymptomatic. Like, that's the big word now, I'm asymptomatic. Why am I here? But I always preface that to say, look, you're asymptomatic until you're not. And this is a very, very important point. We have seen people who have come, and I saw recently even online, one of the tourists who said, look, they came here, they were asymptomatic, and we spoke to them and they were not very happy, and then the next day they were in the ICU. So I think these are the real realities, and we want to preach to Barbadians today, is that these are the real realities on the ground. But I also want to say, look, as we go through this difficult time in country, we all got to pray. We all also have to ask for God's guidance every day before I leave home, to wherever I go, to all the facilities on a daily basis. I always pray that God will continue to guide me to assist every single person, whether they're old or whether they're young. But I think the other part is important, that every single Barbadian recognize that what we're facing in this country right now is not going to get better immediately. It's probably going to get worse before it gets better. I think the problem I continue to see, which is really heart-wrenching for me and many of the healthcare professionals on the ground, and I really want to talk about that even more a bit later, is that people, believe, oh, I feel good, I feel fine, nothing is wrong with me, I don't have to wear a mask, I don't have to be physical distance, it's not important. Right now, we're on a lockdown, and one of the things, if I can I get real?
I want you to be. I want you to be.
One of the things that almost hurts me, and I said it on the last call, but it's continued to hurt me. And when it hurts me, I know it's hurting the other medical professionals on the ground as well. As you drive around on mornings and people are walking and exercising, and that's perfect, that's fine. But then they're doing it in large groups and they're not wearing masks. I don't want to call areas, but the guards in Savannah, I almost pass there every morning. And it's very, 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 very striking what we're seeing in the middle of a pandemic, in the middle of a phase in the country where we're at a very critical stage, at a stage where if lots of people get ill, we have a finite amount of medical professionals. You have a finite amount of nurses on island. And we've asked for assistance, and they're working quite well with us on the ground. But, you know, other countries in the world have faced this. And all the Barbadians who are listening to me today, I know that they all understand what I'm saying. And I know that they all understand the importance of all of those 3 things that we continue to mention. Hand sanitizing, physical distancing, and wearing your mask, not on your chin, right? You know, not on your neck, but wearing the mask appropriately. And people probably are tired of hearing about that. People are probably COVID tired. That's the best word.
Yeah.
They're COVID tired. And I understand that. You've been hearing COVID for a whole year. But the joke about this is that we've been hearing COVID for a whole year, but it was not in Barbados, right? So I think now that the tide has changed, right? The tide has changed in Barbados at this point, and this is why I'm here today. The tide has changed. We are at a very critical stage of this outbreak in this country. And if the average Barbadian has to understand, you know, and the sound of my voice today, the average Barbadian has to understand that if they do not follow these protocols, if they don't follow the rules and the regulations, if they don't stay put for a little bit, there's no need to run to the supermarket every day. There's no need to run to the gas station because it's open because you just want to get $20 in gas. It doesn't make sense, right? We're in the middle of a pandemic, you know, and people are dying, right? The reality strike is that people are dying. We're now at the phase now where our own healthcare workers, and at the sound of my voice again today, our healthcare workers are being affected. And that's where the rubber meets the road. These are the people who are going to protect you from getting into trouble.
Well, let's look at the numbers now in the isolation units. Could you give me a breakdown?
So I'll give you an idea. And a part of this as well is to say, look, you know, the myth that is only for old people in the ICU, I am going to shake that today, right? So we have people in there between the age, in terms of the primary isolation there, between ages of 37 and 77 years old, and some with no comorbidities.
So you have healthy people.
That's right.
That are very sick.
Yeah. There are 18 patients currently in primary. There are 7 females and there are 11 males. 3 of them are currently intubated, including 1 healthcare professional, which is really heart-wrenching for us. In recent times, in recent days, over the last couple of days, we had we would have known of a 45-year-old Trinidadian national who was on dialysis, and she fought a really hard fight, and we fought hard with her. And I think the staff took that one quite significantly because we really tried our best with her because she was a very unique case for us. She unfortunately died. Additionally, another 80-year-old would have died, and then another 75-year-old Barbadian would have died. And yes, those 2 ages are older people. The previous one is a much younger person, but we have younger people in there who may just have asthma or very, you know, other mild diseases. So it's not a situation where it's just older people. And in the secondary isolation, which I would tell you now, is turned into really what it was designed to. And because more people are getting sick. And I made the point to you offline before that we were a state in this country where in the first part of our outbreak, most people in Barbados didn't know somebody who had COVID. They would have heard from some person of some person of a person. But most people didn't know. Now the average Barbadian in this country knows someone out there who actually has COVID, whether it's mild disease, whether it's asymptomatic person, or whether it's someone with severe disease. And that tells you there's a change in tide within the country. I think if we ever get to a phase where every single Barbadian knows somebody who died, that we'll be up a creek.
Just to be clear, the 2 recent deaths, when were they?
Yeah. So the 2 recent deaths would be the Trinidad, this is the previous day. And then today we had 2 deaths.
2 deaths. So we had 3 additional deaths now.
Yes.
So that's taking the total to 24. Last year we ended 2020 with 7 deaths. We're in the middle of February with 24. What has gone wrong?
So I think what has gone wrong is a bit of complacency. People, I think there was always a myth that COVID is with the tourists and the visitors, which was partly true, but people never, I think people didn't grasp the fact that because it's with another human being, that it can be transferred at the winch of a finger. And that transfer can rattle countries. This is what's happened all over the globe. What we're experiencing in Barbados now is not dissimilar to what's happened all over the world. I think what we have the ability or to do right now in Barbados is what we, the average Barbadian can do, right? Which is just wear a mask, physical distance. This is what the rest of the world was not doing. I think we have done so well in this country over time. And I keep saying one of the key things that we do, or we did, which is different to most of the countries, is what we still continue to do, which is to hold a line. So if you have COVID, take you out of the population, hold you to a point where you really are non-infectious, and then allow you to go back into the population. I think this has been one of the most telling things in the country, which is change the tide. But I think that will work well, certainly in our system. But I think if people then don't do the things they're supposed to do, or think that they're okay, or assume, that, I'm not sick, and that's the problem. That's the problem, Lisa. That to me, that is the problem. I think we have to start assuming that the average person that you're at the supermarket with in the supermarket line has COVID. And I've always argued that in this country, one of the safest places in this country is Harson's Point. And people are like, why would you say that? And then because we know what we're dealing with and we know it's there. You don't know what's at the supermarket. You don't know what's at the gas station. You don't even know who's coming to your house, right? And you don't know what they have. And I think the other point to this, why I think the tide has changed as well, is that older people, right? I think sometimes the ball was dropped there to my extent. The older people in the community, people need to check in on the older people, see how they're doing. I think one of the previous deaths before, if I'm getting into much more detail, was a situation where an older guy was in the neighborhood.
And he wasn't seen for a few days. Yeah.
Yes, and people were good enough to check and get him in. Unfortunately, it was a bit late. I think he was almost 7 days behind. But people come in to get medical care early changes the tide of the disease. If you stay home or the sick and safe individuals come to your house and ask about symptoms and you don't say, or you don't say someone is sick in the house, etc., it's going to ravage the healthcare system. What people don't understand is when it rattles the healthcare system, it rattles us. It rattles us. And I am going to talk plainly and freely, right? It rattles us. Nobody asked me to come here to do this today. This was by my choice, right? It will rattle us as healthcare workers. I have a whole heap of young people, including myself, working at Harrison's Point, right? In all divisions, in housekeeping, in orderlies, in procurement, in the kitchen. I don't want to miss a group. That's I'd be slaughtered when I get back to Harrison's Point. Nursing, and especially the doctors, right? There are only a finite amount of them. We don't have a forever amount of doctors in the country, right? And they feel tired at this point.
I can imagine.
They've been going and going, and the numbers are increasing. And when you bring a bus of 20, you bring another bus of another 20, and 15, and then you discharge 24. And it seems like a never-ending battle. One of my biggest things to do, certainly as a director of isolation facilities and manager, is to continue to keep that, camaraderie, but also to keep them motivated, knowing that it's a goal. But the average Barbadian has to help. I can do that from my end, but the average Barbadian needs to understand that they need to know to do what to do. These average, and I'm going to say, right? The average, and sorry if I sound passionate, but I can't help.
That's right.
Right? Because I know where we are at right now. And that's why I'm speaking like this. The average one of those individuals, they're from the city. They were never trained as orderlies. They were never trained as housekeepers. They came in and they were trained and they ran this battle since last year, March. And I hope you're feeling and listening. First, last year, March, these are people, the city young people are this and young people are that. These are people who stepped up for their country, right? And it's hard for them to be every day, 12-hour shifts, beating it and working together, and doctors helping paint walls, and nurses helping paint walls, and orderlies helping paint walls. Things we probably wouldn't do in the hospital, to be frank, right? Help putting up fences and rolling out to try to help people in the campings on the facility. It's hard. Then when they go on the street and they see people not wearing a mask are not doing what they're supposed to do. And one of the things they taught me, I had a staff meeting the other day by Zoom. And one of the things that people feel hurt in their communities, in fact, one of the workers said, Dr. Forde, can you see if you get some masks so I can share out within my neighborhood in the city? Because people ain't wearing masks, and it's agitating her because, you know, she knows the challenges from working on the facility. But to take it further, Lisa, to take it further and to be real, for the first time, we don't have a confirmed case of a worker on our facility at this point, right? But we had a worker who tested recently, a rapid test, and we were waiting the confirmatory test on that. That would be the first person at Harson's Point in almost a whole year, you know, to be affected. And that speaks well for the facility. It speaks well for the function and the understanding of these young people who stood up in this country, from the doctors to the housekeepers on the ground. And it's hard for them then to see, you know, the average Barbadian not taking this thing seriously.
I'm going to get back to the Harrison Point facility specifically, but I want to address something. You got very passionate when you were speaking about the rising cases. Now, on Thursday, the island recorded 43 new cases just from 250 tests. Work that out, that's a positivity rate of just over 17%. Yeah. How concerned are you about something like that?
I am concerned, and I know that's over a period of time, but regardless if it was a period of time or not, I am extremely concerned. And again, this is why I'm sitting here today, because what I didn't finish off by telling you, that's our ICU, as in our primary ICU.
Right.
But our secondary ICU facility, which is now practically an ICU facility, because people there are now between severe and not critical, but have severe disease. And now we're now clocking another 23 patients in there, 15 males and 8 females. It seems to be favoring the males, and every swing. But to say that's now a total of 41 very ill people that I have at Harson's Point. 41 ill people across the board. And notice the age group, Lisa. The age group is not 80-something to 90-something. We're going all the way down to 37 years of age. And to say, I'm telling you 37 today, but we had people 25 years old who were in ICU who were ill. Young, healthy males with nothing, right? And, you know, COVID is not a respecter of persons.
Let's look at the deaths. Now, everyone that has died thus far has had an underlying medical condition, most notably an NCD. The Prime Minister, in her address on Tuesday, said that we have to have a conversation on NCDs. How serious is the situation with NCDs? We know that the average Barbadian either has hypertension, diabetes, cholesterol, or all three, high cholesterol. How serious is it?
And this is real. I mean, what you've just discussed is a real entity. And with the NCDs, and I hate using acronyms, but I'll use it. But the NCDs, it's not only older people. It's now in the younger age group as well. So we're fooling ourselves if we say it's only old people. And our younger population has that as well. That's not only Barbados, it's the rest of the Caribbean. But Barbados certainly has one of the highest rates of diabetes, certainly in the Caribbean. And we all know that. So who in our population is it going to ravish? All of these individuals. And you may not be caught yet. I know the Prime Minister always makes a statement, but I can't quite remember it totally. But said, well, in the catcher in Missia,
yeah.
Right? And that's exactly where we are today. And I smile about that, but I'm serious about this, right? We ain't catching in Missia. And that's the problem, right? There are young people out there, I know, from managing as an internist as well, who have diabetes and hypertension, and they could get in trouble. That could be your best friend. It could be somebody you went to school with. It could be somebody in your neighborhood. So the things that you do will impact everything that happens in the future. And I'm not here because I'm trying to be mean or angry. I'm not. I'm here because I have a genuine concern for the Barbadian public. And as you listen to me today, I need you to follow the protocols and instructions. And everybody doesn't have social media. Clue in someone, send someone the video, send it around the place, you know, saying, look, we need to fall in line with what is requested by the Ministry of Health.
You don't spend most of your days now at the QEH as in the past, but the QEH has recorded more than 50 cases there amongst both staff and patients. How serious is a situation like that in terms of stretching the healthcare system even further.
Yeah, and I think you make a brilliant point. I've always made the point, certainly to many of my colleagues, that there are three key areas in this outbreak that are important. One is ensuring that the public follows the protocols. That's one. Everybody follows the protocols. Two is ensuring that we have a good remit for our emergency system, our emergency healthcare system, meaning the accident emergency department becomes one of the most critical parts in this country, because that still has to take care of, because there's COVID does not mean people will not have heart attacks and strokes and diabetic comas and all the other entities. So when you take that into context, like vehicular accidents and need for emergency surgeries, so these things do not disappear because there's COVID. And, and that's important. So if you factor all of these things into a stretched healthcare system, all it's going to do is be like a rubber band. You're going to keep stretching and stretching and stretching. But I say that, but then I will make the reverse point, which is that the average Barbadian, go back to point one, the average Barbadian can change that by their actions. They can stop the stretching of the healthcare system by what they do, but they have to act. I don't think we are in this country as I see it right now, we are at a point where we need to act, not talk, but act. And when you see someone not following instructions, stop your car and tell them to put on their mask. As plain and simple as that. When people bunched up in the gatherings, tell them that, because at the end of the day, right, if things get rougher, which they will, we know they're going to get rougher.
Will they?
Yeah, I'm sure. I'm sure they'll get rougher. But whether they get rougher or how rougher they get in this country will depend back to us again. It's not dependent on me, the doctor. It depends on the average Barbadian just taking the instruction and following it and running with it and trying to understand, look, it could be me, it could be my household. I think people will only understand when their households gets hit. But by then, it'll be too late. Right? And I really had to come to talk. You've not seen me for a while. Right? I was busy.
2 weeks.
Yeah, about 2 weeks or 3. I've been on the ground really trying to prepare a backup plan for every plan. As the Prime Minister always says, a plan A, a plan B, a plan C, a plan F. Right? To have a backup plan or try to see how we can move things better through the system and how we can refurbish the system a bit.
And I don't think Barbadians have seen you this passionate before.
Well, they haven't. And it is because I think the reason why I'm like this today is because I foresee what is to come if we don't just not pause, stop. We need to stop, reassess. I'm not talking about me as a healthcare professional. I'm talking about the average Barbadian, to stop.
Interesting choice of words.
Reflect on what you're doing and think about what you're doing. Think about why you're going to the supermarket. Thinking why it looked to me as though on Friday, it looked as though it was the 23rd of December. Like 24th of December or 23rd of December. And people were on their last shopping adventure before Christmas. That's how it looked.
No, you always defend your staff, especially at Harrison Point. Over the course of the last couple of months, Harrison Point has taken some criticism on social media from people who were not pleased with the facilities. But you're saying something else is happening at Harrison Point that the public is not aware of.
Well, I think I always say, look, and you heard me say that before. It sounds a bit strange, but I don't mind criticism. I love criticism. I think I thrive off of criticism because it allows me to become a better person. It allows me to change or shift a system into be a better way. And I think as many criticisms as Harrison's Point has gotten, I think it has gotten even
more commendation?
Yes, in recent times. And the reason I'm telling you that is because I know, maybe I should say this, but I'm straightforward. People have gone to hotels and said they want to go back to Harrison's Point. I'm not making that up. That's reality. I prefer to be back at Harrison's Point. And that would sound strange, but it's because but I don't know why it is, right? I think because friendly staff is the same thing you'll get at hotels, etc. But it's interesting, but now you said that, it triggered something off in my head. And this is going to sound very, very strange, but I have to say, and one of the challenges at First Harrison's Point is that we try to remodel and relook at how we do things. And we had some help from Dr. Leacock and Ms. Gail Talmer, the hospital chairman. She's fantastic in this outbreak, I would say, and the board. But I think one of the things we looked at is how we could improve things, and we got a lot of help from Corporate Barbados. We did, and it was the sound of a request, and they did, and we still need more help, by the way. But one of the very sad things that has happened over the last few months, and it really, the tide change, I think when the population has changed as well in Harson's Point, is that there's a lot of stealing of stuff within the facility.
What kind of stuff?
You know me, I always tell the truth, right? So pillows, you won't believe it, right? So pillows, sheets, kettles, you name it. And more recently, a PlayStation. And for me, there are two things to that are important. One, you're not looking after your other fellow Barbadian or visitor who's coming in by doing that, because you're taking away their comfort, because we have to replace them. And it comes at an expense. And interestingly enough, the expense is actually from us, because it's our taxpayers' dollars, or people who donate, you know. And it's hard for me to say that, because I don't want people not to donate because they think something will be stolen.
Right.
We're going to be putting even further measures in place to allow that. But these are things we now need replaced. And it's hard on the staff as well. Go back to my staff. Everything lends back and comes back to the staff at the facility, because it's hurtful. Because if someone comes and say, oh, I didn't have a pillow on my bed, and you well know there was a pillow there, but somebody left and took up one from another room and put it in the suitcase. Or
I was about to ask, how do you leave with something like that?
There are 20 kettles or 40 kettles, or how much of a kettle is a kettle per room, or whatever. You know, you can't steal the microwave, you can't steal the television, right? But it sounds a bit strange, but it's hurtful to the staff, because then we get some backlash for things which, you know, we're trying to still control, but the average Barbadian still has a role to play, right? And I'm not saying there's a Barbadian, it could be anybody, but any of the residents at the facility, I think they need to respect the property of the facility, and, you know, understand that these things are to help other people as well. We may help you at this point, and you may get over, and you may get out and go back home with your families. But what about the other person who's coming behind you? I think we gotta start being our brother's keepers as well in this scenario. I mentioned it with regards to the elderly before, but now with regards to properties and facilities, you know, you gotta respect that aspect as well.
Now, when you entered the specialty area of infectious diseases, did you ever, in your wildest imagination, envision a pandemic?
You know when the last pandemic was, and I'm warned by my infectious disease colleagues, don't worry, Corey, you ain't gonna have to wait that long again. But
wow.
but reality strike. You know, I never would have imagined that this at this point in terms of infectious disease. In fact, I would tell you that, to be frankly honest, infectious disease is not the most, excuse my language here, sexiest of specialties.
True. That's why we only have one.
It's not the most sexiest of specialties. But I think with the advent of Ebola, there was more interest in infectious diseases, but then it dropped again. Again, it's not one of these big money-making areas. We don't make a lot of money in infectious disease part of
But we thank you for your service.
But it's all about providing that level of service. But I think ultimately, I know the Prime Minister is also on a panel with WHO on antimicrobial resistance. In fact, she's the chairman, to be honest, co-chair of the panel for antimicrobial resistance, and that alone is a big feat, because and it's a big ridge in terms of infectious diseases, because that will save many countries across the globe lots of money in terms of fighting antimicrobial resistance. So today is COVID, and we know there's a slow-moving pandemic of antimicrobial resistance is real, and I believe that will be another thing for us in the near future.
I know that you don't make policies. You don't make policy decisions, as you always say. But from where you sit, your professional advice at this stage to Barbadians?
Yeah. So my professional advice to Barbados at this stage, look, is very simple. If you don't have to go out and you're not ill and you're not going to the doctor, right? Just stay home. Honestly, just stay home, right? Staying home is going to be a help to us as healthcare professionals. It decreases our risk of exposure to multiple people. These young people who are down there fighting every day. And back at that again, they can't get off of it, Lisa, because it's the reality. You know, people feel betrodden by what they're seeing the fellow nationals doing. So that's one. The other thing I would advise Barbados is to look out for each other. If you see somebody in your neighborhood and you know they're feeling well, check and find out what's going on with them. You don't have to go to the house. You can call them. There's still things called cell phones, right? So call them, find out what's going on. As simple as that. If you can help someone with some food in the neighborhood, the man who won't have as much as you, do it, right? Be given. This is a time where we got to live together. This is not, I think we are still in this country, this is not about politics. And I'm not a politician, I'm not interested in anything political at all, to be frankly honest. This is not about politics. This is not about male or female or gender or even race. This is about, if we don't get this right.
Survival.
Right? Yes. In short, that's what it's about. And Barbadians have to understand that.
No, I know you're not actively involved in the vaccination campaign, but you did receive your first dose of the vaccine last month, almost a month ago. I think it was in the middle of January. Tell us about the experience. Did you have any effects, etc.?
Lisa, are you telling me or are you asking
I'm
me?
asking you. I'm asking you.
So, oh my goodness. Right. So yeah, I did have my vaccination it's almost like 5 weeks now for my first vaccination. And I always made the joke, and I was there when the Prime Minister got her vaccination. I'm just for the public, and the Minister of Health, the Attorney General, and some of my medical colleagues. I won't call their names because I don't know if they want me to.
That's right.
And they had their vaccines. And to be frankly honest, I got the vaccine, and I'm very close to my family. I'm very close to, especially my sister, and she's always scared for me and everything. I was telling her, just be strong. Everything's going to be okay. I have my faith in God, so I don't worry about much else. And I told my sister that I got the vaccine, and she was in shock. And she was worried. And the next morning I got up, I wasn't even anxious. At one point I can figure which arm I actually got the injection. I'm so serious. Which arm I got the vaccination in. But I think to be frankly honest, like I said, I'm always very frank. The only problem I had, certainly from my memory, and was short-lived, was I had a headache on the day, and I couldn't figure out, this is because I didn't sleep properly or didn't sleep at all, or I was just tired, and I didn't even take anything. I just went to sleep, got up, and the headache was gone. But before I went to sleep, I called my other medical colleague home close. It was my second-hand man at Harson's Point. He's really in charge of primary ICU. Doctor. I just released that information very bad. Dr. Okay. Andre Lovell, and he said, "Oh yeah, I have a little headache too." So I said, "Okay, I'm going to bed." I felt a bit better. I slept and I got up and nothing. And that was it. That was it for me for my first vaccination.
And in terms of your staff at Harrison Point being vaccinated?
My staff, we had our first wave of a vaccination program, and the staff turned out quite well. Yesterday we had our second wave. I think the first wave was pretty quick. And then I had a staff meeting. I think it's important to talk to people there. I was able to talk to my staff. People had reservations initially, but I think that they all waved away. I had a long meeting. I was able to answer many questions, and they were all lined up. You'll see lots of pictures online with them getting the vaccinations with a nice picture saying I've been vaccinated and be happy. So I think those are a young population of people again, which I'm very happy that they got their vaccinations, and encourage all Barbadians to be vaccinated.
Are you surprised at this seemingly anti-vaccination movement?
Well, I'm surprised. I'm just wondering if it really is anti-vaccination movement, or is it the fact that people just got a lot of stuff on social media and ran away with it? I think sometimes when there's a vacuum, people will fill that with whatever information they can get. I think it's incumbent on us as healthcare providers, as healthcare professionals, as people with knowledge about vaccinations. And I've really not spoken a lot about it, to be frank, in terms of vaccines. I mean, others have, but to encourage the general public to if you're in that age that they request you to take the vaccine, listen, take the vaccine. The stage that things are at in this country, I'm strongly advising you to do that. You have questions. There's nothing wrong with having questions.
Of course.
There's nothing wrong with being afraid. There's nothing wrong with having reservations. But at the end of the day, we've seen what's happened with the vaccination. I mean, I'll be happy when every person in the household knows somebody in their household who's had the vaccine. That's when I'll be happy.
When are you due for your next dose?
Very soon.
Just very soon.
Maybe tomorrow.
Okay. Any parting words?
My parting words are to the general public today is we are a critical stage in this country, in terms of COVID-19. We are having certainly to see many more deaths within the country than certainly in the first wave of the disease. We're seeing more younger people being affected with COVID-19. We're seeing more deaths associated with COVID-19 than we've seen in the first wave. We're seeing more people from every community across the country being affected with COVID-19. And I'm going to finish off by saying this. The only people in this country who can change the narrative of where we are tonight, if it's run tonight or tomorrow morning or whenever, the only people in this country that can change this is not the Prime Minister, it's not me, it's not the Minister of Health, it's not the Ministry of Health. They can be involved in making the process the way it's supposed to be and advising. But the only persons, as I talk to you tonight, that can change the wave of where we are in this country to any degree is every single Barbadian in every single household. From the small child in the household who plays with the other child in the park when they're supposed to be at home, to the adult who find themselves in the gas station or the supermarket practically for no reason, or to be walking the road with a mask not on with multiple people, or not appropriately distancing. It comes back again to every single Barbadian playing their part. I can't fight the battle alone. My staff can't fight the battle alone. All the doctors in this country can't fight the battle alone, right? The one bullet that we have right now on this virus is the vaccination program, which has started in this country, which will make a huge change in things. But that is to come. That is not now. That is to come. So the vaccination program is brilliant that we have the vaccine. Some countries don't even see it, or probably won't even see it till the middle of the year. So this is fantastic for every Barbadian, right? So we have something that others don't have. Use it, right? Secondly, and to finish, we have something that others don't have, but at this point, what do we require from you as we find our way through this pandemic in this country, right? It's going to be that every Barbadian goes back to follow the protocols which are set out. Don't be irresponsible. It might not be your life, but it may be somebody else's life. And their life is as important as your life, Lisa, my life, and anyone else who's listening on this call.
Dr. Forde, thank you for sparing a few moments with us to speak to Barbadians tonight. We really appreciate it. And thank you for all you're doing.
Thank you.
That was Dr. Corey Forde, Infectious Disease Specialist and Head of the Isolation Facilities here in Barbados. I'm Lisa Lorde. Good night.